So Brigatinib is another next-generation ALK inhibitor that was recently approved for patients who have previously treated with crizotinib, ALK-positive non-small cell lung cancer patients who were previously treated with crizotinib. The approval was based on a randomized phase 2 study that looked at Brigatinib administered at a dose of 90 milligrams once a day versus a dose of 90 milligrams administered once a day for 7 days and then escalated up to 180 milligrams. A brief background to this study is that in the phase 1 dose escalation study, where efficacy was observed in patients with ALK-positive non-small cell lung cancer who were treated with crizotinib and then subsequently had disease progression, in addition to the efficacy that was observed, they did observe toxicity, a unique toxicity among ALK inhibitors in that patients within the first 7 days of starting to take the drug experienced pulmonary side effects. These were characterized by shortness of breath, cough, and in some patients they were severe enough to be labeled as grade 3 or 4. What they noticed is that this tended to occur in as many as 13 to 15% of the patients at doses of 180 milligrams per day or higher. Interestingly, if patients started at 90 milligrams and then after 1 week, if they did not experience these pulmonary events, then were escalated to 180 milligrams, the rate of these pulmonary events were much lower in the range of about 2 to 3%. So the objective of the ALTA trial was to evaluate the benefits of taking Brigatinib at a daily dose of 90 milligrams versus taking 90 milligrams for a week, and if the patients did not experience the pulmonary events, increasing the dose to 180 milligrams. And what they found was that though efficacy was observed in both arms, patients who received 90 milligrams and then subsequently were escalated to 180 milligrams had much better activity, both overall activity as well as activity in the CNS. So the response rate with the drug, overall response rate was about 55%. And the median median progression-free survival at the 180 milligram dose was 15.6 months at the last update at the World WCLC 2016. With 90 milligrams, the response rate was more in the range of 45%, and the median progression-free survival was in the range about 8 to 9 months. Another important difference between the two dose levels was at the 180 milligrams, the response rate in the brain was about 67%, whereas the response rate in the brain was much lower in the mid-40s at the lower dose. So clearly, the escalated dose provided greater benefit, and not only greater benefit, but a more sustained benefit than what was observed at the lower dose of 90 milligrams. Now, the concern, of course, was this issue of pulmonary events, and they did observe acute onset pulmonary events that is occurring within 7 days of starting the drug, and it was in the range of about 3%. In none of the patients who escalated to 180 milligrams, if they did not experience any pulmonary AEs at the 90 milligram and then they escalated to 180 milligrams, they did not experience any of the pulmonary AEs. In patients who did experience pulmonary AEs, discontinuing the drug, and in some patients managing with steroids did appear to reverse the symptoms. And in those patients, they were continued on 90 milligrams, but this occurred in a very small minority of patients. And so based on this data, recently FDA approved Brigatinib at this at this dose of 90 milligrams for a week, followed by dose escalation to 180 milligrams for patients who have been treated with crizotinib with ALK-positive non-small cell lung cancer and have had subsequent disease progression.